So if you're scheduled for an abdominal or pelvic surgery, or maybe you just had one, and you're going through some things that you're wondering, is this normal or not? Nobody ever told me about these things. Well, then you're going to want to watch this video. My name is Dr. Dawn. I am a pelvic floor physical therapist and specialist in helping women after surgery, especially pelvic and abdominal surgery. And for many women, it comes with a lot of unanswered questions, things they weren't prepared for or are wondering now during that recovery phase, is this normal or not? And they start looking up things online. So here today, I'm going to talk through 4 things that I commonly hear from my clients over time that have come to see me within a week to 6 weeks to 8 weeks, 12 weeks and beyond after surgery. And some of these things are very common, but learning more about it now can help your recovery and help you feel more at ease as you're going through these stages. So the first thing is that their core muscles and their core just overall just feels foreign again. Well, this is very common because those muscles, even if you didn't have a full incision there, but maybe you had little portal sites like a laparoscopic type of surgery, it is creating some trauma in the area, and so it affects how those muscles are going to respond and connect to your brain. So it's almost like we have to start from scratch and train your core muscles to work again. Well, some of the best things that can help you are working on diaphragmatic breathing exercises. If you watched any of my other videos, you know what I'm talking about. But those exercises where you're just focused on deep breathing exercises, trying to fill the belly with air, trying to fill the ribs with air, and concentrating on your breathing, getting the air down in that abdominal cavity and down by your pelvic area is going to help reset those muscles. Your core is made up of your diaphragm, which is your breathing muscle at the top. And so when we start resetting after a surgery of learning how to breathe again, it sounds so simple, but honestly, if we connect those muscles again, that will help your core, your entire system with your back muscles, your abdominals, your diaphragm, and your pelvic floor muscles all together. So some simple breathing exercise I'm going to show you right here. So if you are on your back, you're going to place your hands around your ribs, and you're going to take an inhale through your nose, exhale through your mouth, and try that about 5 times. Then you can take your hands down on your belly, and you take another inhale through your nose, and exhale through your mouth. You want to feel your belly rise and fall with the breath. This way, we're getting the diaphragm moving up and down, and we're getting the air down here, connecting to those muscles again, rather than breathing from your neck and your chest, which is what we tend to do if we experience any pain or discomfort. So resetting those breathing muscles helps reset the whole system with the core, and that is the number one thing you can do to start connecting your brain to that area. So once you've practiced some breathing exercises, you're going to place your hands on your lower belly, right around your hip bones. Just go 2 fingers inward, and I have my fingertips there. And I'm going to think of drawing in, hugging those muscles from my lower belly and pulling them in away from my fingertips. So just like a little drawing in. Once you feel that tension under your fingertips, then you're just going to hold for a second or 2 and then release and let it go. So this is a good way just to get those muscles to kick in again. Now, I wouldn't recommend this right away after surgery, but as long as you've seen your doctor or gotten the check off to start being more active, then you can start seeing how that feels to activate the muscles again and teach them how to work again. Now, if you've had a hysterectomy, my program, the post-hysterectomy reset, I'll put a link below. That is a great way just to connect to your core muscles. Again, I give a series of exercises, and through a series, then you learn some basic Pilates type exercises that are safe for recovery. So connecting to your core again is one of the things I hear a lot of women say their muscles just feel foreign and they forgot how to use that area again. So I've seen this after C-section, I've seen this after any kind of abdominal surgery like a gallbladder surgery or hysterectomy, anything where your abdominal cavity or your pelvic floor muscles have been affected. So surprise number 2, a lot of clients say that they experience bloating. They experience bloating that goes on for a period of time. They still feel like they just had surgery, or they're having a lot of water retention, or they feel like they're about 4 months pregnant and they're having that bloating. So just know this is common. I have heard this from a lot of women after different types of abdominal or pelvic surgeries. Some of the things that can be very helpful in this post-surgical bloating is number 1, movement. So getting the walking routine down, starting to walk a little bit longer every day. You can track your steps on your phone, or if you have an Apple Watch or some device that is tracking your steps, you want to try to increase those at least 500 to 1,000 steps, trying to increase those gradually as long as your body can handle it and you feel okay. You shouldn't overdo it where you feel extra pain or soreness, anything like that. But the walking and the movement is going to help the bloating. The second thing that will help the bloating is lying on your left side. So this helps your digestive system, even having your head elevated a little bit to about 30 degrees. The positions that you are resting in can also help your digestive system and help if there's any gas or pressure and bloating there. Hydration, super important. So warm liquids, especially in that first couple weeks after surgery, this is going to be very healing to your body and providing your body with the right nutrients and hydration. So warm soups or bone broth, things like that, that are going to push that fluid through your body as your body is healing is also going to be very helpful, and making sure you're staying hydrated enough. And then you can take a warm compress and place it on your lower belly or through your abdominal area. This is calming to the area and also can help with that fluid movement and also helps the bloating too. If you're having any signs of constipation, maybe after taking some pain medication, talk to your doctor about what you can do, or just doing some natural things in your diet to help that constipation. But having that gas pressure and digestive pressure can be a big part of the bloating. So even adding magnesium into your diet or as a supplement, that can be very helpful too. So just know the bloating, I hear that a lot, and sometimes it can go on for a longer period of time. So don't be alarmed, but a lot of women do experience the bloating after a surgery. So the third thing is emotions that can come out of nowhere. I want you to know this is what a lot of women experience, and they think they're alone in this, but you can experience just crying out of nowhere, just comes out of nowhere, that you feel very emotional about it. Now, any type of surgery that you've had on the abdominal area or pelvic area can come with some trauma, and also this connection with having a surgery like that, these emotions are hard to understand, and where it comes from, it's something your body sometimes has to go through in its healing. So it is common to have sometimes anxiety at night, or just feel like you're bursting out crying out of nowhere, feeling this added stress or relief that you have to just let it out, let your emotions out, let it go, and just know that is normal. And a lot of women do go through this. It's important to talk to somebody too, talking to your partner or talking to somebody else that maybe has had a similar kind of surgery, being in a supportive community of someone else that maybe has a group of other people that have gone through hysterectomy or gone through a C-section, any other kind of surgery that you've also had. You can hear similar stories, and it's important to talk to other women just like you. I just want you to know you're not falling apart. It's part of the healing process. And even I've seen anger that comes out of nowhere. So think of this like a roller coaster ride sometimes. And we just have to ride that wave, ride it through, let your emotions come out, and do what makes you happy. So finding things that are going to calm your nervous system, whether that's listening to music, whether it's taking a walk outside, whether it's watching your favorite TV show and starting to laugh. Do things that are going to make you feel good. And that is totally normal. From a lot of women I hear that they don't understand their emotions after this type of surgery, but it is normal. So surprise number 4 is scar tissue. You may not realize if you just have little portal sites around your abdominal area, you had a laparoscopic surgery, or even if you don't have a full open incision or a longer incision, that scar tissue can sometimes be surprising. If it's a little tender or you're afraid to touch it, it feels foreign, you don't want to touch it, it's very uncomfortable, or anything rubbing against it. Well, those are all normal too. It helps to learn how to do scar tissue massage and desensitizing the area. I have a whole nother video about how to address the scar and how to do massage techniques that will help prevent any deeper adhesions or any discomfort there. And also it helps you with the core muscle exercises because you're not going to have that skin be bound down with a scar. So portal sites or the longer incisions, they both can develop some scar tissue, and it's very helpful for the healing once you've been cleared by your surgeon to go ahead and start doing a little bit of that massage work. If it's very uncomfortable and you don't even want to touch it with your fingers, I've seen that before, and I've done these little tricks where you can take a tissue and you can use that so it's not actually your fingers, but you're just rubbing that tissue against the incision, and therefore it's creating that your nerves regenerating, and so it's connecting to your brain again, so you're getting that sensation again. You want to start getting that area to understand how to feel again, and if your nerves have been disrupted, we have to desensitize the area and start that again. I've heard from massage therapists too, or other people in healthcare that never knew that you should do scar tissue massage in that area after a surgery, but it's super important, and a lot of times women just had no idea that that should be a thing. So go back and watch the video that I have on this channel all about scar tissue massage. I'll link that down below too. So out of those 4 things, which was most surprising to you? Have you experienced any one of these? Comment below and let me know. I hope you found this video very helpful. Just know you're not alone. There are many resources to help you, and watching these videos, I hope that it helps you learn something about your body and makes you feel you're not alone in this either. So thanks for watching, and we'll see you again in another video. Next up is that scar tissue video.